In this video, I'm going to talk about the infections that are causing genital ulcers. So anytime you have a patient with a genital ulcer, you have to think of one of these 5 infections. So the first one is the genital herpes, which presents with the vesicles and painful ulcers. So important points for diagnosing the genital ulcers is that genital herpes as well as the chancroid, which is caused by Haemophilus ducreyi, these are the 2 lesions that are painful. The rest of these lesions are painless. So patients with genital herpes, which is most commonly caused by HSV2 and sometimes by HSV1, is presenting with the painful vesicles on the genitalia. And then for the diagnosis, you will have to use the Zank test, and for the treatment, you will have to give these patients acyclovir. And acyclovir is an antiviral medication that will get incorporated into the viral DNA, and thus it will prevent viral polymerase action. The next genital ulcer is the Lymphogranuloma Venereum, which is caused by the Chlamydia trachomatis type L1, L2, and L3, and present with the painless ulcers that are followed by inguinal lymphadenopathy. So patients will initially have an ulcer, the ulcer resolves, and then later on they present with an inguinal lymphadenopathy. So just keep that in mind, that these patients do not simultaneously present with the both lymphadenopathy as well as the ulcers. For diagnosis, you will have to order the serological testing, and for the treatment, you can give them doxycycline or macrolides. The next condition is Granuloma Inguinale, which is caused by the Donovan granulomatis, which presents with a beefy red and painless ulcer. So beefy red is the giveaway point for the diagnosis of Granuloma Inguinale. And then on the histology, you will see the Donovan bodies, and then finally doxycycline, macrolides, as well as sulfamethoxide trimethoprim can be used for the treatment of Granuloma Inguinale. Chancroid is another painful ulcer, just like the genital herpes, which is painful. This is also painful. That is caused by the Haemophilus ducreyi. And then for the diagnosis, you will have to use the chocolate agar in addition to factors 5 and 10. So here I have a memory aid table that will help you remember which agars are used for the growth of different bacteria. And I'm not going to go through this entire table for this video, but you just know that for the Haemophilus, you will have to use the chocolate agar as well as factors 5 and 10. And the memory aid that I have for you is that heme buys chocolate with nickels, which is factor 5, and dimes, which is factor 10. So back to the table. For the chancroid, which is caused by the Haemophilus ducreyi, you will have to use chocolate agar and factors 5 and 10. And then for the treatment, you can either give these patients ceftriaxone or azithromycin. And then the final condition is Chancre, which is caused by the Treponema pallidum, which is the underlying cause of development of the syphilis. And these patients present with a painless ulcer. And for the diagnosis, you can directly visualize the spirochetes on the dark field microscopy. And then penicillin G is the treatment that you will have to provide for patients with syphilis. So next, I would like to go in more details explaining the features of syphilis. So syphilis can present as primary, secondary, or tertiary syphilis. So primary syphilis presents with cankers, which are painless ulcers that are present on the genitalia. And an example is shown right here. Secondary syphilis presents with a maculopapular rash on the palms and soles. So here is an example of a maculopapular rash on the palms. And then Condylomata lata is another feature of the secondary syphilis. Now I would like to remind you that Chancre as well as Condylomata lata, these lesions, you can directly visualize the spirochetes on the dark field microscopy. And then tertiary syphilis can present with Gummas, which is a granuloma that has a central necrosis and surrounding epithelioid cells as well as the fibrous tissue. These patients can also present with aortitis due to the destruction of vasa vasorum. So vasa vasorum is a network of the blood vessels that supply the walls of the large vessels, like for instance aorta. So once you destroy the vasa vasorum, these patients will develop aortitis. They also develop Tabes dorsalis due to destruction of the dorsal column of the vertebra, and thus these patients will have loss of vibration as well as proprioception. And then finally, these patients can also present with Argyl Robertsonian pupil, where they will constrict to accommodation but do not react to light. And so for the same reason, because they accommodate but do not react, therefore the name prostitute's pupil is given to it. So it's like a mnemonic. Prostitutes accommodate but do not react. So therefore the name Argyl Robertsonian, the other name for it is prostitute's pupil, because these patients constrict to accommodation but do not constrict to light. And then for the diagnosis of the syphilis, you can directly visualize the spirochetes by dark field microscopy, and this test can be used for patients that have primary syphilis chancre, or they have secondary syphilis with condyloma lata. You can also order the sensitive non-treponemal tests, like for instance VDRL and RPR, and these tests are based on the reactivity of the serum from the patients with syphilis to a cardiolipin. However, this is a sensitive test, and there are other conditions that can interfere with this test and have a false positive. For instance, patients with SLE can have an antiphospholipid antibody which interacts with the cardiolipin, and thus these patients have a false positive VDRL and RPR tests. Other conditions that can cause false positive non-treponemal tests include, for instance, viral infections like mononucleosis and viral hepatitis, leprosy, as well as rheumatic fever. And then finally, we have a specific test that is a treponemal test. And so once someone is positive for the screening test that is used with VDRL or RPR, then you can use the treponemal test, which is specific, an example of which is a fluorescence treponemal antibody absorption test, or the other name FDA-ABS. So this is a specific test that is used to confirm the diagnosis of syphilis infection. Now, for the treatment of syphilis, you will have to give these patients penicillin G. Alright, and then one other last point, which you do not need to know for your step 1 exam, but you will definitely have to know for your general knowledge, is that patients who have positive FDA-ABS from infection with syphilis, this test remains positive for life. So even after you're treating these patients with penicillin G, the FDA-ABS remains positive. So how do you know if a patient who's treated with penicillin G is treated for syphilis actually? And the way to do that is to look for the IG titers of the VDRL or RPR. So you will have to look for the immunoglobulin titers. And so let's say that the patient before treatment had a 164 dilution, which means that you could still detect the immunoglobulin titers for VDRL or RPR after you were diluting the serum by 64 times. After giving the penicillin G, in order to confirm that the patient has been treated, there must be a 4-fold decrease in the immunoglobulin titers. So if the titer drops down from 164 to 116, then that means that you have treated the patient. But if you go and check the FDA-ABS, that's still positive, and that will remain positive for life. And that concludes our discussion of the genital ulcer infections.